Get everything situated here. Well, good morning, and I'd like to welcome everyone to the Iowa Behavioral Health Association. I want to thank Executive Director Flora Schmidt and her team for hosting us here today. I understand you have some board members that are with us also. You know, in recent years, we've made wide-ranging improvements to our state's mental health system, and I'm extremely grateful for the support of those who have shared their stories and added their voices to the ongoing mental health conversation. Organizations like Iowa Behavioral Health Association, Youth and Shelter Services, and a great bipartisan coalition of legislators, all working together, have passed comprehensive adult mental health reform and landmark legislation that established a first-of-its-kind children's mental health system, all providing a full array of mental health services available to Iowans when and where they need it most, which has proven invaluable as we've dealt with the coronavirus in this pandemic. COVID-19 has been a challenging time for all of us, and it's underscored the importance of our mental health infrastructure and access. From healthcare workers on the front line of the COVID-19 response, to families dealing with the new reality of working and teaching their kids at home, to the children who have missed the opportunity to interact with their friends and teachers each day, to the small business owners who are having to furlough employees and see her own life's work become less viable each day, to the recent high school or college graduates finding their future delayed and struggling to stay connected in a world of social distancing. With these kinds of disruptions in our lives and livelihoods, it's important for Iowans to be mindful of their mental health and to know that there's a place to go if they need help. The last several months also have made it more tempting to turn to behaviors that might distract us from the anxiety and the stressors, from online gambling to increased substance abuse or alcohol consumption. Again, it's critical there's a place to turn when we need help getting back to making healthy decisions for ourselves and our families. And that's why we're making meaningful investments in mental health services as part of our state's response to COVID-19. Our mental health providers have really stepped up to the plate to deal with increased demand and the need to accelerate plans for telehealth, bringing critical mental health services online, literally online, due in part to changes made by Medicaid, including an additional $5 million investment in telehealth. So today, I'm announcing that we will be allocating more than $50 million of CARES funding to Iowa's mental health systems. $30 million will be directed to the mental health regions to support ongoing adult and children's mental health services and to help cover the increased needs that have resulted from the pandemic. We're also allocating $20 million to mental health substance abuse providers to mental health and substance abuse providers to cover increased costs during this pandemic. This is in addition to previous provider relief dollars that the federal government has provided for both Cherokee and Independence mental health institutions, as well as hospitals and private practitioners. We also have received nearly $1 million from FEMA that was directed to the Department of Human Services to provide crisis counseling services to those impacted by COVID-19. In Iowa, we take obstacles and we turn them into opportunities. We don't want to just weather the storm of COVID-19. We want to help our system innovate and adapt to the challenges the future holds. So now it's my pleasure to turn the podium over to Department of Human Services Director Kelly Garcia, and she's going to give you a little bit more details.
Good morning. Thank you, Governor. Thank you for having me here today, and thank you for your leadership on this incredibly important issue. While we've been delivery system in Iowa, COVID has changed so much of our landscape, and we must continue to move forward. First, I want to acknowledge the important role our providers have played in our state's pandemic response and the additional responsibilities they've taken on. This is translated to an immediate need for additional supports for so many of our providers, whose work is incredibly important to the state. And there's no shortage of examples of our providers really stepping up to care for Iowans most vulnerable. This has been so challenging. With day habilitation being closed, this has meant increased demands placed on our home and community-based service providers, those who serve some of our most complex Iowans. And now these providers are having to navigate new challenges of how to balance everyday life and well-being while protecting their clients' health. There have also been increased demands on nursing facilities and their needs around additional staffing and mitigation support. And of course, a huge part of this effort has included focusing on mental health services for those complex populations, as well as mental health services for all Iowans. The federal government and DHS have pushed significant amounts of dollars into the system to address these needs. Direct mental health funding in Iowa in response to COVID-19 includes an estimated $10 million of CARES Act funds for our mental health providers, an estimated $10 million of CARES Act funds for substance use disorder providers. Through Medicaid, we've paid out more than $2.5 million in retainer payments to habilitation and home and community-based service providers. Nursing facilities are now able to bill for an enhanced rate of an additional $300 per day for COVID-19 positive patients. Additionally, we received, as the governor mentioned, nearly $1 million from FEMA to provide crisis counseling to those impacted by COVID-19 in Iowa. And this was not CARES Act dollars, but rather paid for by FEMA, and we've recently requested an additional $4 million to enhance this support. Medicaid has also significantly expanded telehealth, as the governor mentioned. In May, Iowa Medicaid spent $9.2 million more in telehealth than we did February, just prior to the outbreak. Though not all is for mental health, a large portion is, as the governor mentioned, around $5 million, and that is significant. We're also seeing patients keep their appointments at greater rates than ever. And I always try to look for bright spots in the middle of this pandemic, and telehealth really has been one of those bright spots. So this is something that we're looking to continue with our federal partners' approval as we build our system longer term. All of this to say, we're paying attention, we're trying to target our efforts, and there is help for those in need. Prior to COVID, we would often talk about the need to end stigma around mental health. And now I find myself engaged in a similar conversation when those test positive for COVID-19, or for providers or establishments with COVID-positive patients. This too is not productive. We need Iowans to be open to share when they feel ill or test positive so we can mitigate the spread. And those who are in need of mental health services know that help is available. You can access assistance and free counseling at covidrecoveryiowa.org. Of course, I am always grateful to our incredible team at DHS, and I thank you, Governor, for the additional investment and your support in these efforts.
Thank you, Kelly. Also with me today is Andrew Allen, who is the President and CEO of Youth and Shelter Services, to share his perspective about how additional funding will help impact the young lives his organization serves. Andrew?
Thank you, Governor. Wow, did you say $50 million? That's a big number, and I want to thank you personally. I want to thank you because that's what it's going to take in order to start addressing the behavioral health needs that our state's going through during this pandemic. A year ago, as a member of the Children's System State Board, I was with the governor as she signed legislation creating Iowa's first children's behavioral health system to address the mental health and substance use disorder needs of Iowa's youth. I heard her say that day, next, we work on the funding. And while we could not have predicted the pandemic or the legislative session or the CARES Act, this funding could not have come at a more critical time for our state. As mentioned, I'm Andrew Allen. I'm the President and CEO of YSS based in Ames, providing services in the areas of prevention, treatment, child welfare, and transitional services to more than 20,000 youth and families statewide each year. And while I'm currently the CEO of YSS, I'm actually an alumnus of YSS services. 25 years ago today, I was celebrating my 18th birthday in YSS's Adolescent Addiction Treatment Program, a program that saved my life and has served more than 5,000 youth from across this state since its inception. After being arrested for felonies at 10, expelled from school, diagnosed a sociopath, YSS provided treatment, helped me find God, gave me new life skills, and set me on the path for long-term recovery. So for me, this is personal, and I know that treatment works and that recovery is possible. Mental illness, substance use disorder do not discriminate. The National Institute of Mental Health shows 49.5% of adolescents, 1 in 2, will have a mental health illness. 1 in 6 of us will have a substance use disorder, and 90% of those will start before their 18th birthday. So look around. All of us will be impacted, if not directly, by 1 degree of separation. Yet, as Director Garcia said, the stigma still exists. People are afraid to talk about their struggles and that of their family. I see it in my own community. When kids start secluding themselves and not talking, or acting out and the police get called, oftentimes, instead of asking for help, families are embarrassed. They feel judged, and they don't seek treatment, instead suffering alone. On average, the delay between onset of symptoms and mental health and someone seeking treatment is 11 years. 11 years living with a diagnosable and treatable illness before even seeking treatment. And today, because of the pandemic and isolation, the trauma that kids are facing is increasing, and for many, it's happening behind closed doors. The uncertainty that families are experiencing is creating increased levels of stress and anxiety and depression. And as has been reported, suicides are up across the board. Kids and families need help, and this funding for the mental health regions and the providers like YSS could not have come at a more critical time to help address the need. YSS is one of just 29 member agencies of the Iowa Behavioral Health Association working to create better behavioral health through education, prevention, treatment, and advocacy. At the start of the pandemic, as social distancing took hold, as Kelly mentioned, each of these agencies stood up telehealth counseling therapy services in short order. YSS was working with a young man early in his recovery from meth addiction who became extremely isolated because of the pandemic. We saw symptoms of anxiety and depression worsen, and we knew he was at high risk for relapse. Telehealth therapy was a lifesaver, giving him direct and regular access to a licensed clinician to work through our new normal. And by late April, I'm happy to report he was showing significant improvement and proactively managing his health. Many providers also continue to provide inpatient residential treatment as well, with licensed and increased protocol to limit the spread of COVID-19. Just last month, I was talking to a father whose son was completing our residential inpatient treatment program in Mason City, the same program the governor helped us cut the ribbon on and open 2 years ago. As he thanked the staff, he turned to me and he said, "You may have just saved my son's life." Treatment works, guys, and recovery is possible. So on behalf of the providers that deliver the treatment and the mental health regions that help coordinate and fund services, I thank you. On behalf of the families and the kids that will benefit, I thank you. And for every individual or family or young person who's struggling with depression or anxiety or addiction, this is not your fault, and you are not alone. I've been there. Don't wait 11 years. Treatment is available today, and it works, and recovery is possible. I'm living proof. Thank you, Governor Reynolds. I look forward to helping to advocate for permanent and stable funding for the system alongside you and Director Garcia over the next year. You said $50 million, right?
Thank you, Andrew. I appreciate that very much, and I appreciate you sharing your personal story, and this is personal for me as well. I share a very similar story, so thank you. In addition to caring for Iowans' mental health during this challenging time, we also continue to focus on protecting Iowa's physical health as well. COVID-19 remains active in our state and across the nation, and we know that testing and contact tracing is key. Last week, Test Iowa sites across the state once again surpassed the daily capacity of 3,000 tests per day. All sites were closed on Friday in recognition of the Independence Day holiday. Still, more than 13,600 Iowans were tested through Test Iowa from Monday through Thursday. Yesterday, nearly 33,700 more tests were conducted. Of the more than 400,000 total COVID-19 tests that have been completed in Iowa and the more than 150 labs across the state and nation that are processing test results for Iowans, sorry. The Test Iowa, I'm sorry, I just lost my brain. The Test Iowa program accounts for more than any other testing option. More than 85,000, or 21% of all tests in the state, have been conducted at Test Iowa sites, and all in just 10 weeks since the first site opened on April 25th. As demand for testing continues to grow, Test Iowa appointments are filling up quickly. So even though we've far exceeded our capacity for the last 2 weeks, we're mindful that we can push our capacity limits only so far. While our volume of tests are in good supply, we are considering different ways to adjust operations at some of our testing sites and at the State Hygienic Lab so that we can further expand capacity and meet the demands of Iowans who want to be tested. We're also going to be opening up additional clinic sites. We continue to make a lot of contacts with counties and clinics across the state of Iowa, and tomorrow we'll be opening a new site in Kossuth County, which will be located in Algona. Some of the increased demand is likely being driven by an uptick in positive cases in some communities, and with more people gathering in larger numbers, whether that's at the bars or restaurants, social events, or even protest, there is a greater chance that more people will be exposed to COVID-19 and become infected, and especially if recommended precautions to prevent the spread of the virus aren't being taken. Over the month of June, we've seen an increase in positive cases among adults ages 18 to 40, particularly young adults in Iowa's college towns and larger cities. In the 2-week time frame from June 21st to July 5th, nearly 82,000 Iowans were tested. And of that, almost 94% of those tested negative, compared to 6.5% positive. On average, the state's 60% of the on average across the state, 60% of the positive cases were among adults aged 18 to 40, compared to 21% among middle-aged adults, 19% among older adults, 8% among children, and 2% among the elderly. And 10 counties with the highest number of new positive cases during that time frame accounted for 65% of all of the positive cases. The top 5 counties alone account for nearly 50%, and those include Polk, Johnson, Blackhawk, Scott, and Story. So, as we do every day and have throughout this pandemic, we closely monitor these counties as we've seen daily positive rate increase over the last week. And while it's not cause for alarm, it is concerning. There's a perception that because COVID is less serious for younger adults, that an increase in positive cases among this age group isn't an issue. But that perception is false. The consequences of COVID-19 continuing to spread among young adults increases the likelihood that the virus will continue to spread and then will spread to others, including those who are most vulnerable. Our decisions matter. Protecting yourself means that you're protecting your friends, your family members, and your coworkers. And for those who work in manufacturing, healthcare facilities, long-term care facilities, or other congregate living environments, that's an especially important decision. Your decisions could potentially affect the lives of others. Tomorrow, we met yesterday, and tomorrow we'll be meeting again with Dr. Badati and my team to review the data, to look at the 7-day and 14-day trends, to look at hospitalizations, number of vents and ICU beds being utilized, and numbers available. We'll continue to monitor the positivity rates and look and see if there's any additional measures that need to be taken so that we can mitigate and contain and manage the virus among Iowans. Until then, I'm asking every Iowan to remain vigilant. As I've said at almost every single press conference, COVID-19 remains in our communities, and we must continue to practice the same public health measures that we have since the start. And that is wash your hands, practice good hygiene, social distance if you can't, wear a mask, and if you're sick, stay home, to effectively protect the health and the health of others, and to keep Iowa on a road to recovery and open for business. And with that, we'll open it up for questions. And if you have questions for the other topic too, would you guys be willing to step back up if we need you to potentially answer any questions that they may have?
So after your press conference last week, as you were leaving one of your events here, the vehicle you were riding in struck a black lives matter
I do feel like the driver acted appropriately, and I think if you look at the report that Commissioner Baines and the Department of Public Health put forth, as we were leaving the vicinity, the individual sped up and stepped in front of the vehicle intentionally, and you cannot block traffic as we're leaving an event. And so he acted inappropriately, and I believe that that was the statement that was released from the Department of Public Safety.
Have you been in touch with them at all?
I have not.
What's your view of county and city ordinances about wearing a mask in public requiring?
Well, we don't believe that they can, and that is in conjunction with the Attorney General. We believe that when the Public Health Disaster Proclamation is in effect, unless the local government's declaration or proclamation is consistent with the state proclamation, unless it's consistent, then it's not appropriate, or it doesn't go into effect.
So, Governor, would you consider readjusting that proclamation so it's consistent? I mean, you just said that, young people shouldn't ignore the risk to them.
Yeah.
Their decisions impact others, and
Yep.
obviously mask wearing is intended to protect others, not
Yep.
themselves. So,
And I think
why
that they
not
can be,
tinker with that?
I think that they can be, well, we're going to take a look at everything, but I've said all along, well, here is the criteria. This is the same information that we've given to Iowans from the very beginning. People need to practice personal responsibility. We have said if you can't social distance, then you need to wear a face covering, and we're going to continue to elevate the importance of doing that. We need to stay home when you're sick. You need to practice good hygiene. You need to wash your hands frequently. And so we'll take a look at the data. People are responding. We have seen a little bit of an uptick. We're going to monitor that. It's been consolidated in anywhere from 5 to 10 counties. The 7-day trends look like they're starting to move down a little bit, but we're going to continue to monitor that, and we'll react appropriately.
Why doesn't the local community have the ability to do what it thinks?
Well, according to the statute, if the governor has a declaration in place, if the county declaration isn't consistent with and it's in a health disaster proclamation, which we have in place, if it's not consistent with that, then it's not appropriate and it's not in effect. And I believe, if you're referring to the Muscatine County, that their county attorney also just ruled this morning that he believed that it was not in concurrence with the declaration at the governor's public health disaster proclamation. So he is, I think, more or less said it's null.
Is there a mechanism by which you could allow local entities
Yep,
to
and
do
that's
that?
some of the things we'll look at. All things are on the table, and we're going to continue to review, manage, mitigate, and contain the coronavirus. We can do that in a responsible way. There's so many other factors that go into it. You just touched your mask. You just took it off. So then you're spreading the germs. So there's just so many things that go into that. If somebody wears the same mask for 7 days without appropriately washing it or changing it out, then is it doing what it's supposed to be doing? Who's going to monitor that? What we can do is continue to educate and provide data and the information to Iowans so that they know where some of the hot spots may be, where they know where we're seeing some increase. When we do the contact tracing, if we're seeing a lot of the increase due to bars, young people attending bars in the evenings, then maybe we need to take a look at the hours, or maybe we need to take a look at rolling back some of the mitigation efforts on bars. So there's a whole host of things that we can do to really help provide the information to Iowans so that we can continue to move forward, continue to open up, and continue to recover and help Iowans get back to the new normal. But we can do it, and I don't think it should be any surprise. As we start to open up, people have been locked down. They're ready to get outside. They're ready to get together with friends and family, and so I don't think it's entirely surprising that we've seen a little bit of an uptake. So now we need to dig into the details. We need to figure out why, and then we need to talk about maybe what we can do. What are the next steps that we can do to continue to protect Iowans, to continue to make sure that we're not overwhelming our hospitals. Let's not forget that's what we need to be looking at. We can't just focus on the number of positive cases. The more that we test and the more that we get out and we open up, you're going to see those go up. But are they overwhelming the hospital systems? Are we seeing the availability of beds and ICU numbers start to go down? What's the positivity rate look like? There's a lot of different a lot of different data that we'll look at to help drive those decisions.
Governor,
Metrics.
On contact tracing, sorry, I cut you off there. Last week you said that you're changing the way you're reporting recoveries because some people aren't returning your call on the second call to follow up. I'm wondering how widespread that is and how, if anything, is impacting your ability to effectively contact trace and find out
No,
people's close contacts.
the contact tracing is really important at the beginning, I think, and that's why we want to make sure that we're doing it in a timely manner so that we can start to understand the scope of the increased virus activity. And so when somebody tests positive, when they reach out to him and understand who they've been in contact, where they've been, who do they need to let know that they've potentially been exposed to the coronavirus. But from the recovery standpoint, I mean, so we're doing a lot of contacting of individuals, and sometimes if they don't return the call, then we weren't moving into recovery. They put a pretty high bar in place. It's the same metrics that they used when long-term care facilities come off of outbreak status, and if they weren't able to get a hold of an individual that had tested positive after 28 days, then they move into the recovery. And that's 2 incubation periods. So I mean, it's a pretty high standard that we're utilizing, and also I think it allows us to use our assets and our resources more effectively and really focus on the front end so we can understand who's been exposed, make them aware so we start to contain the spread of the virus.
Governor, with testing, I'm hearing from people who are saying that there are no times available at their Test Iowa sites, or there's long waits, things like that. You mentioned that the Test Iowa program had exceeded 3,000 tests today. I'm wondering if there's enough capacity still, or if you're aware of these reports that people aren't able
Well,
to.
yeah, because we're testing more and anybody can test, and so we've asked them to be patient. I talked about that in my remarks. I mean, it's a reflection of the success, and I'm so grateful to to Test Iowa that has really provided that capacity for us. I mean, think where we'd be if we didn't have the availability of testing that we do with Test Iowa. So be patient. I think the more that we get, right now we have 8 drive-up sites or 10. We're between 8 and 10, I think, that have the test sites, the drive-up sites. But every day we're bringing on new clinics, and that's really going to help, I think, with some of the, especially access in rural Iowa, and then just address some of the overflow that we're seeing. So be patient. You know, we're trying to open up as many slots as are available, and it's also like, you know, just finding healthcare professionals to help operate the drive-up sites is also a part of the component that we've struggled with a little bit, just making sure that we have adequate personnel to provide the testing.
Governor, both Pocahontas and Webster counties are seeing a pretty significant bump in cases. I'm not sure if the Webster County case bump might have to do with the outbreak at Fort Dodge Prison right now, but do we know why those are happening?
Yeah, well, we're doing some of the contact tracing. Some of that would be attributable to the outbreak at the prison. I'm proud to say that over the weekend the team worked incredibly hard to make sure that we had testing in there. They've already tested about 300 people. Of that, 39 tested positive, 3 inmates, 3 staff. I talked to Dr. Garby this morning and Dr. Padati. They are scheduled to do another 600 tests, I believe, tomorrow, and that's inmates, and then an additional 100 staff will also be tested. So again, it's just incredibly important for us to get in there, do the testing, so we can understand the scope and to those who have been exposed, do the isolation, and really take the measures that we need to take to prevent it from spreading throughout the facility. I do want to compliment Director Skinner from the Department of Corrections, because she has really been very diligent in putting procedures in place to be prepared in case there was an outbreak in the prison, and so and that worked. I mean, they kicked in, they did what they were supposed to do. They have isolation areas for those that are tested positive so that they can separate individuals that have been tested negative. And so I want to compliment her and her team and Department of Public Health for really coordinating the efforts to really get on top of that, and they've done a really good job from that perspective.
This is going to be the last question.
Okay.
You're expecting changing guidance for schools opening. I understand the Vice President today is emphasizing the states need to get schools open.
Yeah.
The guidance that has been put forth so far seems to have people concerned. Are you hearing that, and are you confident that the leadership has been in place to give them the proper
Yeah, they put a lot of time into it, and they're balancing a lot of information. So They're balancing CDC, they're balancing the Department of Public Health, they're balancing the Academy of Pediatrics. They put out some guidelines, and so we're trying to take a look at all of those. You know, we need to get kids back in school for a whole host of reasons, and Andrew listed several of them. And I believe without hesitation that there's a way that we can do it in a safe and responsible manner. And we are innovative, and we are resilient, and we are determined. And so we need to take that same type of mindset and work with our educators and work with our young people and work with parents, you know, to make sure that we can get our kids back in school and do it in a safe and responsible manner. Hey, I want to say one other thing while I've got him here. You know, Test Iowa and just all of the testing clinics and just with through the State Hygienic Lab, but especially if you're using Test Iowa, because anybody can go get a test. But I need people just to remember, too, that that is a snapshot in time. So just because you go in and get a test and you test negative, remember that you could be exposed the next day or the next day. So if you start exhibiting some symptoms or you find out you've been around somebody that has tested positive, you can go back and get tested again, which is another part of what we're seeing. People are getting tested more than once. But just remember, when you get that test at Test Iowa, that is a snapshot in time. So at that particular time, you are testing negative. But that doesn't mean that you couldn't potentially get it going forward. So we just want Iowans to keep that in mind, to continue to use the services. We're continuing to reevaluate the processes and looking for ways that we can, you know, even expand our capacity. We've got enough tests to be able to do that, but we're just, you know, there's a lot of other elements that we need to take into account as well. And I want to just, again, thank the State Hygienic Lab and Dr. Pintella and his team. They are working around the clock because we have exceeded the capacity that we talked about when we entered into addressing and dealing with COVID-19, and he really has stepped up to make sure that we're getting the test results back to Iowans in a timely manner, and I appreciate that so much. Thank you.